let's continue now. I'm John again, and this is Amy, my patient, and we're gonna do the neck and lymph nodes. All right. So I'm looking across her throat. I want to see if there's any kind of deviation to the trachea. So I can just run my hands down the trachea right here. Everything looks fine. I don't see any redness or swelling across there. I don't see any swelling around the lymph nodes. Okay, is everything all right? Okay with your neck? Okay, so I'm going to go ahead and palpate the lymph nodes. And you guys want to have these lymph nodes memorized and be able to pull them out handy. So to palpate lymph nodes, you just want to use your finger pads, and you just want to feel, kind of roll your fingers around, and you're just feeling to see if you feel any hard nodules underneath the skin. They might feel about the size of a small pea. So this is the pre-auricular lymph nodes here, and then behind the ears across the mastoid process is the posterior auricular lymph nodes. And then I'm going to come down here to the angle of the jaw, right here at the angle of the jaw, and bring my fingers up inside the angle of the jaw for the tonsillar. All right, and keep inside that jawline to feel the submandibular right here, and then have the patient put their tongue against the roof of their mouth and feel the submental right at the tip of the jaw right there. I'm going to go back to the tonsillar and turn my hands against the neck right here. Right there, 2 fingers, I'm feeling the superficial cervical lymph nodes right along in here and in here. Now I'm going to come down this line and push the sternocleidomastoid out of the way. 1, 2, 3 locations right here to feel the deep cervical lymph nodes. Some people might come this way to feel them, in front of the sternomastoid or behind the sternomastoid. Some might come in front of it right here. Okay? Now I'm going to go across where the base of the skull is right here in the back and feel up along the base of the skull and across the base of the skull to feel the occipital lymph nodes. And then I'm going to work my fingers down the trapezius, feeling the posterior cervical lymph nodes. So I'm coming down the trapezius, feeling across the top of the trapezius right here, all right? This range right in here and inside this fossa to feel the posterior cervical. Now I'm going to come straight down the fossa right here and have the patient hunch their shoulders forward and feel the supraclavicular lymph nodes right in here. Okay, the supraclavicular. And once again, if I wanted to look at the posterior and the occipital lymph nodes, I'm just going to indicate to you where those would be. So I'm going to come along to the base of the skull right here and feel along the base of the skull and up around in this region right here for the occipital lymph nodes, and then come down the trapezius, feeling down the trapezius here, right, and feeling across the top of the trapezius here for the posterior cervical. Now you'll have different names for different lymph nodes in different textbooks, but that's just what we use right here. And then once again, I'm going to come over here, have her hunch forward and feel the supraclavicular right along the midclavicular line inside that fossa right there. Okay. All right. Now let's take a look at the thyroid now. So we're going to have you turn this way. And I like to go through and just identify the landmarks of the neck when I check the thyroid. So we go very to the very top of the throat up here. We'd have the hyoid bone across there. I'm going to palpate across that and then come down. And the next bony structure we're going to come across would be the thyroid cartilage. The thyroid cartilage, you can feel the little V right in the center. And it's the Adam's apple, and it's much easier to find that on men than on women, but there it is right there. And I'm going to come down that center line from that V and feel the next little V right here, and that's the cricoid cartilage, right? The cricoid cartilage stretches right across here, and when she's talking, that cricoid cartilage will move up and down. I'm just going to come right below the cricoid cartilage, rest 2 fingers against her throat right here. Now I'm going to ask her to swallow, and some people may need to have a glass of water to swallow it. So you want to see if there's a glass of water handy or if they need some water, but can you swallow okay? All right, so my 2 fingers are right here, swallow. And I'm just feeling a little movement of a band of flesh right across here, which is the isthmus of the thyroid. I'm going to come out from either side of the isthmus of the thyroid, here and here. I'm going to palpate right in here. I'm going to have the patient swallow again. Okay, very good. And I'm feeling the 2 lobes of the thyroid right there. All right, very good. Now it is possible to do that examination from the front side also, from right here, and that is just a feel for the landmarks, find that cricoid, press 2 fingers here, and then press 2 fingers there for the isthmus of the thyroid right here, and then for the 2 lobes of the thyroid right there. Okay, and that takes care of that part of the examination. Thank you very much.